Our next presenter is Dr. Mangal Dave. He is going to present his innovative video laryngoscope, Tascope.
Good morning, respected seniors and friends at TACON. My name is Dr. Mangal Dave. I come from Rajkot. I work at Gokul Super Speciality Hospital. Majority of my work is in neurotrauma. And today I have come to tell you something about design of video laryngoscope, which may be very useful to us in our day-to-day practice. Being anesthetist, we face daily, day-to-day challenge. In our day-to-day life, we face airway challenges. And for these airway challenges, video laryngoscope has been advocated by the Difficult Airway Society and American Society of Anesthesiologists. The DAS guidelines 2015 suggest all anesthesiologists should be trained to use video laryngoscopes, and regular practice is required to ensure that the improved laryngeal view successfully translates into successful intubation. ASA practice guidelines also suggest higher success of video laryngoscope as a category A1B recommendation. These are some of the currently available laryngoscopes in market, but they are very expensive, they are out of reach of many, and some come as a single-use devices. Repeated uses are not possible. So what we are suggesting is, we have incorporated an endoscope camera with either a smartphone which is compatible to it or a tablet, and we use a special designed channeled blade to incorporate all this thing into a video laryngoscope. This is a video. The patient is conventionally induced and relaxed, and I am intubating the patient with our design of video laryngoscope. You can appreciate the amount of mouth opening which is required and the amount of neck extension which is required to intubate. We have a channel for bougie. Once the larynx is seen, we pass bougie through the channel, which the channel ensures untraumatic passage of bougie into larynx. Once the bougie is inserted, over it we railroad the tube, and under vision we can ensure atraumatic safe passage of the tube. This video laryngoscope is particularly, it can be very useful in peripheral setups where no big things are available. The tube is secured. He is another patient with one finger of mouth opening, a road traffic accident patient with hard palate injury and nasal bone fracture. This we are showing is the view from the endoscope camera from the video laryngoscope itself. This patient again is conventionally induced. You can see the blood all around, as well as the clear view which is shown by the video laryngoscope. Now we can see the epiglottis, and lifting up the epiglottis shows the larynx. The the bougie passage is just next to the camera. It comes from the right of the camera and enters the larynx. And over the bougie, the tube will be railroaded. So the advantages of our Tascope, it is very much affordable, reusable. Camera can attach even to our smartphones, which are compatible. We have both channeled and non-channeled blades available. The blades can be autoclaved, and it is a slim design which easily enters this restricted mouth opening. Although there are some limitations, it is handmade, it lacks in aesthetic looks. The tubes are fixed over steel bed with Fevikwik and Araldite, which shows wear and tear with repeated uses, and the tip may come out and we may have to refix it again. Thank you.
Thank you, Dr. Mangal.